Hi, my name is Kent Johnson. We're for LA Sports Performance Care. This is my model, LA Man, and we're going to demonstrate today a sciatic nerve floss or nerve glide. The connective tissue that the nerve has surrounding it and around the spinal cord and around the brain is called dura mater, and that's what patients often present what we call dural tension. That connective tissue does not slide through the muscles or through the other connective tissue of the body, and also the nerve itself does not slide through the outer sheath. You often see this a lot with poor movement, joint mobility, in the ankle and the knee and the hip and even coming out of the spine. You oftentimes see this following a hamstring injury or when a patient actually presents with a muscular imbalance or muscle inhibition of the glutes and the hamstrings because the hip flexors, iliacus and quadriceps and some other similar tissue actually are shutting it down. And right now, Ali is actually presenting a little bit today, fortunate for us, with a little bit of sciatica. So what Ali is going to do, she's going to sit up nice and tall. Okay, so she's going to actually lengthen her spine. She's going to extend her knee and dorsiflex her foot. That means she's going to pull her toes up towards her knee. She's actually going to invert her foot and actually internally rotate her femur. And now she's going to rotate her spine to her left. Now, if you notice, she also has her right leg hanging off the table so she can go ahead and actually stabilize her body. So she's going to actually move one part of her spine or one segment of her body at a time to actually create the appropriate tension. She's going to start off with cervical flexion, so she's going to chuck her chin down. And you have to keep your knee locked and keep pulling your toes back, so she's going to stay down there. Okay, so she's going to keep her knee locked, she's going to pull her toes up, she's going to create that tension, she's going to go forward with her body a little bit more, so she's going to go into a thoracic flexion, and now she has tension on it. Now she's going to keep her body flexed forward, she's going to pull her head back into extension. She's going to do that 5 times. This may be pretty intense, but it's a very, very good exercise as far as getting the sciatic nerve to slide better. And then once she does her 5 reps, she's going to tuck her chin down. She's going to go forward more, but she has to keep her knee locked, keep pulling her toes back towards her. Okay? And then she's going to flex forward a little bit more, create some more tension. There she goes. And then she's going to pull her head back and forth 5 times again. Good. And then now she's going to go ahead and stay there. She's going to make sure she corrects her technique. She's going to rotate to her left again, her upper body. She's going to make sure she locks her knee. She pulls her toes back. Now she can also floss it by actually plantar flexing and dorsiflexing her foot. And now she's actually stretching the nerve from the distal end as well as from, obviously, before the proximal end. And she can do that 5 times. She can also do ankle circles, 3 to 5 in each direction. But make sure that you don't lose the internal rotation of the femur while that's happening. And for some of you, you may actually find that to be a challenge. This is best performed or most effective if you actually do this exercise 2 or 3 times a day. And you only need to do a couple of sets of 5 with the head going from the chin tuck to extension or plantar flexing and dorsiflexing the foot. You don't want to aggravate this nerve, but you do have to go ahead and get it stretched out and get it sliding through the connective tissue. If you find it challenging to go ahead and do this or you're not getting the results that you want, then that may also mean that we need to actually manually do what we call a long track nerve release, which is a form of soft tissue nerve release by ART. Okay.